Hi, my name is Pete Larson. I'm a physical therapist at OSI, Physical Therapy in Shoreview, and I just wanted to take a minute and talk a little bit about shoulder injuries and some recent articles that have come out regarding shoulder injuries, specifically rotator cuff tears and impingement, or sometimes it's called tendinitis. A lot of people that have these conditions and they're not exactly sure what they should be doing, whether they should go have a surgery done, whether they should just let it rest, whether they should do something else, and I just wanted to highlight a couple studies that have talked about that topic. So there's been two recent studies that are actually called meta-analyses. And before I get too deep into the terminology, a meta-analysis is basically it just pulls together a bunch of research and it comes to a conclusion on a topic. So these two studies looked at rotator cuff tears and they looked at impingement issues in the shoulder or pinching issues in the shoulder, or tendinitis commonly called as well. And what they wanted to look at was whether people did better if they had surgery for these conditions or if they did better just getting conservative care first. And they followed these patients up for a year, sometimes longer, to compare how they did. And what they found is that patients who had surgery or did not have surgery and just did physical therapy strengthening actually had similar outcomes. And so the suggestion in both of the studies was for people to try conservative care first because they can save themselves a ton of time and money by doing strengthening exercises prior to trying to go have surgery. So what does that mean for you? That means if you do have shoulder pain, you should consider asking your physician whether physical therapy would be the right place for you first. And then you should do some research on finding a physical therapist in your community that can help you. A good physical therapist should evaluate your condition. They're going to look at your range of motion, they're going to assess your pain, they're going to look at your strength, and then based on what they find, the impairments that are present, they'll create a specific program to help you. So for people that have high pain, they might do some manual therapies. It might be a joint, some joint mobilizations that should help reduce pain, or they might use something like a Graston tool, which works on soft tissue. It can have short-term pain benefits. If you have range of motion deficits, they'll give you exercises that are working on stretching those. Most people, because it's a muscle injury, they need to focus on strengthening, and so the physical therapist should definitely give you strengthening exercises to work on as well. Typically, these conditions, they resolve relatively quickly if you're compliant and do your exercises consistently. We've seen maybe 6 to 8 weeks. If it's a big injury, it might take a little bit longer. But when you compare that to the surgery for a rotator cuff tear, often people are still having symptoms a year out. That's not too much to ask to have your symptoms reduce that quickly and get back to doing the things you love. So if you have a shoulder injury and you have further questions, you can find us on our website at www.osipt.com or check in with your doctor and ask if PT would be right for you. Thanks.